For E. coli, we have four topics: the general characteristics of E. coli, E. coli of cattle, E. coli of swine, and E. coli of poultry. So for the general characteristics of E. coli is gram-negative, middle-sized, has a capsule and flagella. They are also lactose positive, catalase negative, and oxidase negative. When it comes to culturing E. coli are non-fastidious. Fastidious means difficult to please. This means E. coli will grow on almost all agars. This includes a simple nutrient agar, hemolytic strains will grow on a blood agar, and septicemic strains will make shiny mucoid colonies. And since E. coli is gram-negative, it'll also grow on MacConkey agar, because MacConkey agar stops gram-positive bacteria from growing. For the antigens, K antigens are on the capsule, think of K for capsule, and O antigens are on the cell wall. The F antigen stands for fimbriae. These are like little hairs that adhere to the intestinal mucosa. And H antigens are on the flagella. There are 80 K antigens, 180 O antigens, 19 fimbriae, and 60 H antigens. For E. coli, the virulence factors are the capsule, the adhesions, the endotoxins, and the exotoxins. The capsule has K antigens. These are the exotoxins. The adhesions are the fimbriae, the F antigens. They adhere to the intestinal mucosa. And the endotoxins are the O antigens on the cell wall. For the fimbriae, F1 is common, F2 and 3 are in humans, F4, 6, and 18 are in pigs, 4 and 6 are in young pigs, and 18 is in older pigs. And F5, 17, and 41 are in calves, F5 is also in lambs, and F7 to 16 cause urinary tract infections in humans and in poultry. So the endotoxins, which are the O antigens, are made of lipopolysaccharides. These are known as LPS for short. When E. coli gets into the bloodstream, it is destroyed by the immune system, and this will cause the LPS to be released from the destroyed bacteria, and the LPS will then cause hemorrhages. These hemorrhages can cause animals to die from shock. The exotoxins are the toxins on the capsule. Exotoxins are divided into enterotoxins, verotoxins, and cytotoxic necrotic factors. The enterotoxins are heat labile and heat stable. Think as L for labile and S for stable. These enterotoxins will stop the reabsorption of sodium, and as sodium is excreted, water will be excreted as well. They cause hyperosmotic diarrhea. The verotoxins are verotoxin 1, verotoxin 2V, and verotoxin 2E. They inhibit protein synthesis, which causes hemorrhages. And for cytotoxic necrotic factor, there's cytotoxic necrotic factor 1, 2, and 3. The pathogenic E. coli strains can be divided into intestinal strains and extraintestinal strains. For the intestinal strains, think of PTV, HIA. All of these strains have the prefix entero before it except for verotoxigenic. So we have enteropathogenic strains, enterotoxigenic strains, verotoxigenic strains, enterohemorrhagenic strains, enteroinvasive strains, and enteroadhesive strains. The enteropathogenic strains have intamin, the enterotoxigenic strains have LT and ST, and the verotoxigenic strains have VT1 and VT2. And the enterohemorrhagic strain has the Shiga-toxin 0157H7. For the extraintestinal strains, think of SMAO, septicemic, meningitis, avian pathogenic, and uropathogenic. And for E. coli of cattle, there are 3 diseases: coli septicemia of calves, coli diarrhea, and calf dysentery. So for coli septicemia of calves, they are caused by septicemic strains, which are extraintestinal strains. It is a facultative pathogen and needs predisposing factors, such as not getting enough colostrum at birth, bad hygiene, overcrowding, or cold weather. The fimbria of coli septicemia is F17. So the bacteria enter the body orally and then they colonize the gut, and when the predisposing factors are there, they'll replicate and then they'll enter the bloodstream, and then the bacteria is lysed. And then LPS, lipopolysaccharide, is released into the bloodstream, and this will damage the blood vessels and cause hemorrhages and shock. The disease usually occurs in the first week of life. There is no diarrhea, however there's inflammation in all the organs such as the lungs, the brain, the heart, and the liver. There is no treatment, it's too late. Calves can get infected orally or through the navel. They get fever and hemorrhages and die. The next disease is coli diarrhea. It is caused by enterotoxigenic intestinal strains. Just like coli septicemia of calves, it requires predisposing factors, such as not getting enough colostrum at birth, poor hygiene, overcrowding, or cold conditions. The fimbriae of this disease are F5, F17, and F41. The fimbriae adhere to the gut, and then the exotoxin ST, which is heat stabile, causes the excretion of sodium, and this, as a result, causes the excretion of water as well. And as a result, the young calves have yellow, watery diarrhea. They do not get fever, unlike septicemia. However, they run the risk of getting dehydrated. To prevent this, there are 2 inactivated vaccines you can give to the dam before she gives birth. The last disease is calf dysentery. It is caused by virotoxigenic strains and enterohemorrhagic strains. The exotoxins are VT1 and VT2. Cows are usually subclinical, but they carry the agent. This disease, like the rest, requires predisposing factors. It affects calves between the ages of 2 weeks and 8 weeks. Calves get chronic diarrhea, and since virotoxin 1 and virotoxin 2 inhibit protein synthesis, there will be hemorrhages in the colon, but they're only found in the colon. This disease also has a zoonotic risk. Humans can be infected through feces or contaminated meat or milk. The shigatoxin O157H7 causes hemorrhagic gastroenteritis in humans. For E. coli diseases of swine, the diseases are diarrhea of newborns, diarrhea of post-weaned, and edema disease. For diarrhea of newborns, it is caused by enterotoxigenic intestinal strains. The fimbria are mostly F4 and F6, but sometimes F5. As a facultative pathogen, this disease requires predisposing factors, such as low colostrum, overcrowding, and bad hygiene. So what happens is, the fimbriae adhere to the gut, and then the LT and ST, which are the heat labile and heat stable exotoxins, cause sodium to be excreted, and then water is excreted with the sodium. This causes yellow watery diarrhea in newborn piglets. It is important to note that the LT and ST exotoxin are present for the E. coli diarrhea diseases of swine. However, for the E. coli diarrhea diseases of cattle, it's only the ST exotoxin that is present. For diarrhea of post-weaned pigs, enterotoxigenic intestinal strains are the cause, and sometimes virotoxigenic strains. Since they are older pigs, the fimbria F18 is the main one, but sometimes there's also F4. This disease requires predisposing factors, such as bad hygiene, overcrowding, stress, or viruses. Just like the diarrhea of newborn piglets, for post-weaned pigs, fimbria 18 adheres to the mucosal membrane, then LT and ST cause the excretion of sodium, and as a result, this causes hyperosmotic watery diarrhea. However, in post-weaned pigs, the diarrhea is not yellow. This is because, in newborn animals, their diarrhea is yellow as they are consuming milk. For both of these diseases, in the pathology we can see a very compact full stomach and no lesions in the intestine. For both of these diseases, rehydration is so important. You can also treat them by giving them antibiotics. And for the diarrhea of newborn piglets, if the piglets are being born to first-time gilts, you can vaccinate them with vaccines against the F4 and F6 fimbria. This strategy is not done for the post-wean pigs because they are past the point of maternal immunity. For edema disease, it is caused by virotoxigenic intestinal strains. The fimbria for this disease is F18, and the exotoxin is VT2E, which inhibits protein synthesis. The predisposing factors for this disease are overcrowding, poor hygiene, and a high protein diet. Usually, the biggest pig in the herd is affected first. The high protein diet will result in slow peristalsis, and this will give bacteria time to replicate. And then VT2E is absorbed into the bloodstream. And since it inhibits protein synthesis, it'll cause hemorrhages and edema. For the clinical signs, there is almost a 100% mortality. We can see edema in the eyelids, the front of the face, the nose, and the ears, as well as in the larynx, where they'll be squealing, and they'll also have dyspnea, and they'll be struggling to breathe. This disease has no fever and no diarrhea. We can give a vaccine against F18, but not against VT2E. For E. coli diseases of poultry, these are caused by avian pathogenic extraintestinal strains. They can infect the birds through means of germinative infection or by horizontal infection. E. coli contaminating eggs can kill the embryo, or it can result in very weak chicks being hatched. It is often associated with co-infections from mycoplasma and viruses. The fimbria are F1 and F11. When the disease takes on a septicemic effect, in young chicks only 1 day old, we can see diarrhea and delayed absorption of the yolk sac and death. In adults and in growers, we can see pericarditis, perihepatitis, arthritis, as well as dyspnea and erysiculitis. In hens, they get coli granulomatous on the liver and in the intestines. It is generally not zoonotic. However, virotoxigenic strains and enterohemorrhagic strains can be. And last but not least, these are not topics, but they were on the lecture. In rabbits, when they have a low fibre diet, they can get diarrhea and edema in the gut. It's usually associated with coccidiosis. In cats and dogs, E. coli infections are usually associated with suckling babies, normally enterotoxigenic strains, and cats can also get virotoxigenic strains, which causes enteritis, as well as urogenital and pyometra. And horses can get septicemia.